Good morning and welcome to the WAVY Digital Desk. I'm Sarah Goode, and today we're going to be talking about health and what's coming up this year. We have Dr. Leah Rowland from CHKD Pediatric Specialists joining us to answer really what your questions are as parents and families heading back into this year. We can talk about what we're going to expect, just ways to stay healthy every day and more. So I'm going to bring on Dr. Rowland now. Dr. Rowland, thank you so much for joining us this morning. This is, the last of a back to school series we've been doing, and I think this is probably one of the top concerns on a lot of people's minds as we head back to school. So I think, it's really important, and thank you so much for taking the time to join us today.
Thanks for having me.
And I did want to say, so Dr. Rowland, she's with CHKD Pediatric Specialists. She's also the co-chair of the School Health Committee for the Virginia American Academy of Pediatrics. So, just to add to why this is so relevant today, why Dr. Rowland's joining us, and what we can talk about. So I just wanted to start. Last year, we saw a triple epidemic, is what they called it, triple-demic. We saw, different cases of COVID, RSV, flu. We weren't sure when the RSV season was going to be. We're seeing a lot of different things sort of affecting kids, and some of the things have similar symptoms for parents, so you're trying to decipher, what everyone has. But, what did you all take from last year? Is there anything we can start with, the past before we move forward?
That's right. I think we all had a fear that all three would hit at the same time, and we didn't see that last year. So we're hopeful that this year, and we don't know if that is because one virus kind of shuts out another temporarily, but we'll see what happens in the fall. Certainly the pandemic has shown us that it's difficult to predict things that were happening regularly in the past, as far as, RSV used to occur at a different time of year than what we saw in the summer of last year even. And so we're certainly all being vigilant. We're glad that, kids are in school, we have vaccinations available, and I think taking advantage of what we've learned from the pandemic and utilizing the resources that we have to keep kids healthy. Doing that together should, we're going to see illnesses, but we can keep our kids as well as possible and recovering from those if we just use the tools that we have.
Absolutely. And, school got started a little earlier this year for some kids. They're going back this week, and then the next group will go back next week. But for them just starting out, they're going to be back in a pool with a lot of other kids, a lot of other people. Same goes for teachers. What is the best way, just, right off the bat, to keep people healthy, to keep people sickness free, especially at the beginning of the school year?
That's a great question. I think, again, it's falling back on the tools that we've always seen effective with respiratory and viral illnesses in general. And that's the basics of hand washing. That's keeping your kids home when they're ill with a fever or they just feel rotten. That's better for I always tell my parents, it's good for your own child to recover from the illness. And then think about, if you're the parent of another child in that classroom, how would you feel if your child is sitting next to you? That they treat others the way that we want to be treated, and also to keep our own kids recovering. So we've also learned a lot in the pandemic. I've been glad to see that schools have focused more on ventilation, and we've certainly seen that better ventilation and leads to improved less spread of illnesses. So I'm hopeful that with the improvements and attention that schools have given to ventilation, for instance, will be helpful. So all the improvements we've made in the pandemic, if we can keep those going and use some of the money that's been out there for infrastructure for schools to improve that will be helpful. And the good old fashioned wash your hands, stay home if you're feeling terribly sick, that all applies.
Right. Because I think, work too. For adults, going to work, especially after COVID, it's like, do you go in if you have sniffles? Do you not go in? And you're sort of debating. But, if a kid is showing signs of, even a more serious cold, what's best practice? If you're able to, should you have COVID tests at home? Should you have, certain medicine readily available? Or does that mean a visit to the pediatrician if you can, or an urgent care nearby?
That's a really great question. And I don't think it's a one size
Mm-hmm.
fits all answer, because if you have an asthmatic child and they get a cold, it's going to be different for them. If you have an elderly member of the household who really needs to know if there's COVID in the home, there's a variety of nuances there that I would empower the parents to, be in touch with their healthcare provider. But for a healthy child and an overall healthy household, if they have a bit of the sniffles, but they're on the recovery, I think if we kept our children home with every little sniffle that they have, they wouldn't be in school or daycare much. That being said, I really think it's that rule of if they feel rotten, or there's another risk factor either in the home or in the child, then they need to stay home. And we're here as healthcare providers to help with that decision making.
Absolutely. And then, going into this year, you're on this, you're co-chair of this health committee for schools. Is there anything that you all are really focused on or that you're on alert for this year?
Sure. I think one of the things that, and you've talked about this too, is mental health, anxiety. Some kids were out of school for quite a while. In general, we're seeing just a lot more mental health concerns with our children. So I think one of the focuses that we have is a return to just overall well-being for our children. And that means healthy eating. We've lost one thing that our school committee is looking at is we used to have universal school lunches during COVID for a little while, and districts were seeing that kids were less hungry at school because they had access to food, and 1 in 11 kids in Virginia is hungry. So we're concerned about the nutrition of our children that helps with their health. We're concerned about exercise and obesity rates skyrocketing during the pandemic. So just a return to kind of overall health with particular attention to mental health of our kids.
Yeah, and last week we did a conversation 2 weeks ago with CHKD about bullying, and that was a big topic we had in that relation to mental health. So we sort of got into some of what you need to know about that, how to communicate with your kids and some of that. But I mean, that's interesting. Besides sort of the viruses and flus, we're concerned right now, as you said, about health, well-being, so mental health and the food part. And with packing lunches, sometimes it's difficult to fit it into the morning schedule, and you want to just throw in something easy. But what do you all recommend? I mean, do you recommend having something from every food group in a lunch if you're able? Do you recommend switching it up every day? Is it good to eat the same thing every day? Because some kids just want the same sandwich every day. What are some of the best practices there?
I think the biggest thing parents can focus on is trying to give their kids real food. And by real food, I mean food that's not processed, that when you read the label, you know what those ingredients are and where they came from. Fruits and vegetables. So it's okay if your child only eats apples and that's what they want for lunch. Then they're going to be eaten and they're easy to transport. Use the other meals during the day to have them try new foods, and then keep trying. Know that sometimes trying a food 30 to 40 times is necessary before they start to be able to eat more than a few bites of it. So don't give up. And then when you model the behavior of eating healthy foods and you don't bring those processed foods and sugary foods into the home, or at least you try to limit it, you try to don't feel that you're not punishing your child or doing anything mean by not giving them juice every day and things like that. So just do your best on focusing on real food in the lunch.
And especially as kids are growing and, that middle school phase where like bodies are changing and they need, how much sleep do kids need? Do they need, 7 hours? Do you need 10 hours? Do you need more than 10
Yes,
hours?
it's a great question because I see so many exhausted children that are then brought into the office with either illnesses or they're worried and anxious and sad and or they're not attentive at school. And then when I talk to them, it's because they're in a lot of activities and really overscheduled and the whole family is exhausted. And so when you look at infants, they need anywhere from 12 to 16 hours of sleep a day. And then toddlers, less so, they're 11 to 14. School-aged kids, 6 to 12, it's estimated 9 to 12 hours. And our teenagers need 8 to 10 hours. And there's not many teenagers that are getting that amount of sleep, which is probably, they're fairly cranky some of the time, right? And some of that is just that they're tired. And if they nap and stay up too late, that can really affect the sleep. And so some of my parents will ask about melatonin and supplements, and I don't recommend those in general. It's best, I try to teach my families about understanding how the body works and what helps kids sleep. And one of those ways to help kids sleep is exposure to early morning light, which they're going to get anyway if they're going outside to school. Another is to have their own melatonin kick in by getting off the screens at night, which is very difficult when they do all their homework on screens. But if they can cut those screens off, including tablets and phones and all of it, an hour before bedtime, that will really help quite a bit.
Yeah, I mean, the sleep is huge. I think especially as you get older, you have more homework, or maybe you're getting stressed about college. Finding those hours to get that rest is very difficult, especially with maybe after school activities. I think we all fall victim to the phone trap, before we go to sleep at night. So I think, that's great. Get off the phones, get off the screens. And actually, last week in a conversation I had with FBI, Norfolk going back to school, talking about more security on internet and stuff. They actually even say that so that you're not up with your phone at night, doing anything private, risking anything. It's good to have the phones out on a table, just protect yourselves, get off the screen. So that fits hand in hand right there.
That's absolutely right. And it really factors into kids' well-being. So I would encourage families to know how the phones work, know how you can do your child a favor by just using the screen time, where you can just have the phone shut off automatically at a time. And that way it takes the decision away from the child a little bit. So it's just like lights off type of thing. So.
And then, going back to school this year, we've had a couple interesting years of COVID and then post-COVID. And, there's been a lot of different learning types for people. And there's been a lot of, struggles, I think, in the classroom. You hear from teachers across the board about, kids wanting to move around more, kids not being able to sit still as much. You just hear about a lot of different things. And this is going to be, I guess, the third year post-COVID that kids are back in school. But is there anything that you all are concerned about, in regards to sort of their overall well-being after COVID, the social part, if kids had missed that maybe in elementary school or middle school? Are there any sort of social interactions that you all are sort of looking at?
I think we've all been seeing those for a while now. And so we're hopeful that kids will continue to gain improvements in their social connections and how they handle emotions. And that kind of ties into the mental health. So we knew that the pandemic had a really big impact with the isolation on many, many children, and some are still behind. And those that are behind are often those who have the least access to resources. So it's really our job as a society to look at where the struggles are occurring and try to support the kids who need the extra help, because many kids still were home alone on these Zoom school days because both their parents were working, because they were, they needed the money, they're essential workers, or, they're working. And so the kids who often have the least have the most that they need to catch up on. So.
And that's interesting because I think that's something that we're probably going to be studying or seeing studies about, going forward, especially at, the really small, almost, toddler age of kids not really getting to interact, especially when they weren't in school yet. So it'll be interesting to sort of see how that goes and from our teacher, friends or colleagues about, how that will be this year for them and what they're going to see in the classroom.
And I think supporting our teachers is part of it, right? Because we have to believe that our children can recover from this, and that, children are incredibly resilient, but they do need the support, and our teachers really need us right now. So whatever we can do for them, we should.
And then, the last piece, parents going back to school know this well, physical health forms, sports forms. I mean, there's so much paperwork to be done from, the pediatrician side, but another big thing, is vaccinations and immunizations and trying to figure out what your kid needs, what your kid doesn't need. I mean, is there anything that you all are seeing or that you all are recommending, from CHKD going into this year?
Oh, absolutely. And you can certainly go to our CHKD website and read all about vaccinations. We have an extensive health library with lots of questions answered, in addition to the AAP website. I would say, in general, the childhood vaccinations, most of them have been around a very long time. And I would encourage people, ask your questions of your pediatricians. We all know the data and can answer those questions for you in person. And I think that one-to-one contact can really be helpful. But then secondarily, going into the fall, I would strongly recommend the flu vaccine, and I would not wait for that. We've seen the flu earlier these years. So as the flu vaccine becomes available to you, or, via your clinic or pharmacy, however you're able to get that for you and your family, will really help. It's been around for 50 years, and it's been shown to decrease risk of hospitalizations. And I see that every year. Some years we see that, boy, it's really, really effective. And other years it's a little less effective, but it always is effective, and to some degree.
And, is that a conversation that you have with your pediatrician when you're going back to school? You offered that it's up on your website, and I can link that, for anyone watching to get more information. But, who's the best person to sort of talk to about what your child needs?
I would say your pediatrician. I'm a bit biased, but I always tell my families, if you're getting advice from, a lot of them feel pressure from family members who are doing this or doing that differently. And so go talk to us. That's what we're here for. And then stick to the reliable websites is what I would do. I really like our CHKD website, our aap.org. And you can either look at other hospital systems. And so I think that's what's important, is that there's not a lot of variation, because science is based on facts. And so if you look at Children's Hospital of Philadelphia and CHKD and University of Virginia, in general, the pediatricians across the board are all recommending the same things. So if you'd like to just do reading on your own, stick to the major medical centers who are reading the data and helping with that. But a lot of my families just want to have a personal conversation, and that's what we're here for.
And then you brought this up earlier in the conversation, but I just want to, maybe end with this and then, give the floor to you for anything else we need to bring up before our conversation ends. But, the mental health piece, is there anything that you tell your parents, hey, watch out for these signs with your kid, or, after their day ends, here are some questions you can ask to really know what's going on? I mean, what do you sort of recommend to parents?
I usually do it on an individual basis, because parents know their kids best. And so if parents are around, make yourself available, and then trust your gut. If you feel that there's something wrong with your child and they're really locked down and not talking to you, especially the teenagers, you can take them in to see us, and we can talk to them one-on-one. So I would say, don't think your teenagers, as much as they might be shoving you away, they still need you more than ever. And then as far as younger kids, look for signs of just behavioral changes, poor sleep, a lot of crying. Sometimes it comes out as anger, but I find that a lot of my parents really are aware that there's something going on. So I would tell them to trust that and don't be afraid about bringing them to us, because we do screen for some of these things at the office, and we're all very in tune with looking for the signs from our end too.
That's great. I mean, it also just says, parents, hey, you're not alone. You have resources available. Bring your kiddo in and, see what perhaps, could be the problem.
And I think parents should not feel scared about going to mental health. I think it is being destigmatized. From talking to my own teenagers, they know a lot of their friends who go and talk to therapists, and it's not like it used to be. It's kind of like you wouldn't just throw a baseball, you'd have a coach show you how to throw the ball. And so I tell my families, it's a coach to kind of teach you how your brain works, and how you can there's scientific ways of figuring out how to cope with your feelings and anxieties. And so it should be destigmatized, and parents can help with that. And then kids aren't afraid to speak up.
Absolutely. Well, Dr. Rowland, thank you so much. I mean, I'll make sure that we're out by 11, but, is there anything else that, you all on your committee are looking at, or that you're focused on? Any of like the top questions that we just didn't get to?
I would say in general, right now we're looking at what schools need, and I think they need resources and support. And there's a lot of short staffing that's happening there too. So we need to support our schools and our school nurses. Virginia doesn't have school nurse in every school, and so I hope that will change. I think it's healthy eating, exercise, and mental health, which it really includes not being overscheduled. So don't be afraid to back off on an activity or something like that if your child's exhausted, even if it's something that they enjoy. Just be aware that a lot of our kids are overscheduled and need their rest.
Well, Dr. Rowland, thank you so much. And I will point everyone to the CHKD website, if they need other advice, to look at the, vaccine conversation that we had, to look at more resources. So thank you so much. And if you're watching, this is the end of the back to school series, for this August. But, there's so much good information from this conversation, a previous one with CHKD about bullying and others. So please head to wavy.com to view more resources and links from CHKD. Dr. Rowland, thank you so much again.
Thanks for having me.